Jessica had always been told that periods were just something women had to endure, a natural part of life. But as she navigated her late 20s, her menstrual cycle began to feel more like a roller coaster than a routine. Some months, her period would arrive like clockwork, light and manageable. Other times, it was a torrent of pain, heavy bleeding, and mood swings that left her bedridden. She started missing work, avoiding social events, and feeling overwhelmed by the unpredictability of it all. After years of brushing off her symptoms as normal, Jessica decided to seek help. What she discovered was that her experience was far from uncommon, but it was also something that didn't have to be endured in silence.
Jessica's story is one that resonates with many women. Menstrual health is a critical aspect of women's overall well-being, yet it's often misunderstood, overlooked, or dismissed. Understanding your menstrual cycle, recognizing the signs of potential disorders, and knowing when to seek medical advice are essential steps toward maintaining good health and quality of life. This comprehensive video will explore the basics of the menstrual cycle, common menstrual disorders, and when it's time to seek help. Understanding your menstrual cycle. The menstrual cycle is a natural process that prepares a woman's body for pregnancy each month. It involves a complex interplay of hormones that regulate ovulation, menstruation, and other reproductive functions. A healthy menstrual cycle is a sign that your reproductive system is functioning well, but it can also be influenced by various factors, including stress, diet, exercise, and overall health. A typical menstrual cycle lasts about 28 days, although cycles ranging from 21 to 35 days are also considered normal. The cycle is divided into several phases. Menstrual phase, days 1 to 5. What happens? This phase begins on the first day of your period. The lining of the uterus or endometrium is shed through the vagina, resulting in menstrual bleeding. The average period lasts between 3 to 7 days. Physical and emotional impact. Many women experience cramping, bloating, breast tenderness, and mood changes during this phase. The intensity of these symptoms can vary from person to person. Follicular phase, days 1 to 13. What happens? Overlapping with the menstrual phase, the follicular phase begins on the first day of menstruation and continues until ovulation. The pituitary gland releases follicle-stimulating hormone, or FSH, which stimulates the ovaries to produce follicles, fluid-filled sacs that contain eggs. One follicle will become dominant and prepare to release an egg. Physical and emotional impact. Estrogen levels start to rise, leading to an increase in energy and mood. The body begins to repair the uterine lining in preparation for potential pregnancy. Ovulation phase, day 14. What happens? Ovulation occurs around the midpoint of the cycle, typically on day 14 in a 28-day cycle. The dominant follicle releases an egg, which travels down the fallopian tube toward the uterus. This is the most fertile time in the menstrual cycle. Physical and emotional impact. Some women may experience mild cramping, known as Mittelschmerz, on one side of the pelvis during ovulation. Libido may increase during this phase, and cervical mucus becomes clear and stretchy, resembling egg whites. Luteal phase, days 15 to 28. What happens? After ovulation, the empty follicle transforms into the corpus luteum, which produces progesterone. Progesterone helps thicken the uterine lining to prepare for a possible pregnancy. If the egg is not fertilized, the corpus luteum breaks down, leading to a drop in progesterone levels and the start of menstruation. Physical and emotional impact. Progesterone can cause symptoms such as bloating, breast tenderness, and mood swings, commonly referred to as premenstrual syndrome or PMS. Some women may also experience fatigue, food cravings, and irritability during this phase. Common menstrual disorders. While some variation in menstrual cycles is normal, significant changes or symptoms that interfere with daily life may indicate an underlying menstrual disorder. Understanding these disorders and their symptoms is essential for seeking timely treatment. Dysmenorrhea refers to painful menstrual cramps that occur before or during menstruation.
There are two types. Primary dysmenorrhea, which is common menstrual cramps caused by the release of prostaglandins that trigger uterine contractions, and secondary dysmenorrhea, which is painful periods due to an underlying condition, such as endometriosis, fibroids, or pelvic inflammatory disease, also known as PID.
Symptoms include intense cramping in the lower abdomen, back pain, nausea, headaches, and fatigue. Secondary dysmenorrhea may also cause heavy bleeding or pain during intercourse.
Treatment options include over-the-counter pain relievers like NSAIDs, hormonal birth control, heat therapy, and lifestyle changes such as exercise and stress management. Treatment for secondary dysmenorrhea depends on the underlying condition.
Menorrhagia is characterized by abnormally heavy or prolonged menstrual bleeding.
Women with menorrhagia may soak through a pad or tampon every hour, pass large blood clots, or bleed for more than 7 days.
Symptoms include heavy menstrual flow, anemia which can cause fatigue and shortness of breath, and severe cramping.
Causes can include hormonal imbalances, uterine fibroids, polyps, adenomyosis, and bleeding disorders.
Treatment options range from hormonal therapies like birth control pills and IUDs to tranexamic acid, iron supplements for anemia, and in some cases, surgical options such as endometrial ablation or hysterectomy. Amenorrhea is the absence of menstruation for 3 or more consecutive months in a woman of reproductive age who is not pregnant, breastfeeding, or menopausal.
There are two types: primary amenorrhea, where menstruation never begins by age 16, and secondary amenorrhea, where menstruation starts but then stops for 3 or more months.
Causes can include hormonal imbalances such as PCOS or thyroid disorders, excessive exercise, eating disorders, stress, and certain medications.
Treatment involves addressing the underlying cause, which could mean lifestyle modifications for stress or weight management, hormonal therapy, or surgery in cases of structural abnormalities.
Oligomenorrhea refers to infrequent menstrual periods, typically occurring at intervals greater than 35 days. It is often associated with irregular ovulation.
The symptoms include fewer than 6 to 8 periods per year, irregular menstrual cycles, and sometimes heavy bleeding when menstruation does occur.
Causes can range from PCOS and thyroid disorders to excessive exercise, stress, and hormonal imbalances.
Treatment often involves hormonal therapy, lifestyle changes, and addressing underlying conditions such as PCOS.
Premenstrual syndrome, or PMS, is a group of symptoms that occur in the luteal phase of the menstrual cycle, typically 1 to 2 weeks before menstruation. Symptoms can range from mild to severe.
On the other hand, premenstrual dysphoric disorder, or PMDD, is a more severe form of PMS that significantly impacts daily life and emotional well-being.
Symptoms of PMS include bloating, breast tenderness, mood swings, irritability, food cravings, and fatigue.
PMDD symptoms are more intense, including severe mood swings, depression, anxiety, anger, and physical symptoms similar to PMS.
Treatment for both conditions can involve lifestyle changes like diet and exercise, stress management, hormonal birth control, antidepressants such as SSRIs, and cognitive behavioral therapy. Polycystic ovary syndrome, or PCOS, is a common endocrine disorder characterized by elevated androgen levels, irregular menstrual cycles, and polycystic ovaries.
Some of the symptoms include irregular periods, excessive hair growth, also known as hirsutism, acne, weight gain, and difficulty conceiving.
The exact cause is unknown, but it's believed to involve a combination of genetic, hormonal, and environmental factors.
Treatment options often include hormonal birth control to regulate periods, medications like spironolactone to reduce androgen levels, lifestyle changes such as diet and exercise, and fertility treatments for women trying to conceive.
When to seek help. Recognizing the signs of menstrual disorders. It's important to know when menstrual symptoms are not just a part of your body's normal process, but a sign of an underlying issue that requires medical attention.
Here are some signs that it's time to seek help.
Severe pain. If menstrual cramps are so severe that they interfere with your daily activities or require you to miss work or school, it's time to consult a healthcare provider. Severe pain may indicate conditions such as endometriosis or fibroids.
Heavy bleeding. If you experience very heavy bleeding that soaks through pads or tampons every hour, lasts more than 7 days, or is accompanied by large blood clots, you should seek medical advice. Heavy bleeding can lead to anemia and may be a sign of an underlying condition.
Irregular periods. If your menstrual cycle is consistently irregular, meaning your periods are unpredictable, absent for months, or occurring too frequently, this could indicate a hormonal imbalance or another underlying issue such as PCOS.
Missed periods. If you miss 3 or more periods in a row and are not pregnant, breastfeeding, or menopausal, it's important to see a healthcare provider. Amenorrhea can be caused by various factors, including hormonal imbalances, stress, or eating disorders.
Severe PMS or PMDD. If you experience severe mood swings, depression, or anxiety in the weeks leading up to your period, and these symptoms are impacting your quality of life, you may have PMDD and should seek help from a healthcare provider.
Pain during intercourse or bowel movements. Pain during intercourse, bowel movements, or urination during menstruation may be a sign of endometriosis or other pelvic disorders and should be evaluated by a healthcare provider.
Unusual symptoms. Any new, unusual, or concerning symptoms, such as sudden changes in your menstrual cycle, unexplained weight loss or gain, or changes in your skin or hair, should prompt a visit to your healthcare provider. Jessica's journey to menstrual health, finding balance and relief.
After years of struggling with my menstrual cycle, my decision to seek help was life-changing. My healthcare provider conducted a thorough evaluation, including blood tests and an ultrasound, which revealed that I had PCOS.
With this diagnosis in hand, Jessica began a treatment plan that included hormonal birth control to regulate her periods, dietary changes to support hormonal balance, and regular exercise to manage her symptoms.
Over time, my periods became more regular, my symptoms improved, and I regained control over my life. I learned that my experience wasn't something I had to endure silently. There were solutions available, and seeking help was the first step toward finding relief.
Jessica's story is a reminder that menstrual health is an integral part of overall well-being, and it's important to listen to your body and seek help when something doesn't feel right. Menstrual health is a vital aspect of a woman's overall health, and understanding your menstrual cycle is key to recognizing when something is off balance. While some variation in cycles and symptoms is normal, significant changes or discomfort should not be ignored. Whether you're dealing with painful periods, heavy bleeding, irregular cycles, or severe PMS, there are solutions available to help you find relief and maintain good health. If you're experiencing symptoms that interfere with your daily life or are concerned about your menstrual health, don't hesitate to seek medical advice. By taking proactive steps to understand your cycle, recognize potential disorders, and seek help when needed, you can achieve better menstrual health and improve your quality of life. Remember, you don't have to navigate these challenges alone. Support and treatment are available, and your well-being matters.